In this video, we'll be discussing Standard 7 from the domain Curriculum, Teaching, and Learning, or CTL 7. CTL 7 states, program has a written policy outlining the implementation of developmental screening that includes that screenings are performed in accordance with the instrument guidelines, or at minimum at 9, 18, 30, 42, and 60 months, as well as 3, 4, and 5 years of age, in accordance with CDC guidelines. A system is established to refer families to further evaluation that address children's developmental and behavioral needs. What's the intent? Early childhood programs should conduct regular developmental screening because it is a proactive way to support each child's growth, identify potential concerns early, and connect families to appropriate resources. Regular developmental screening can support early identification of delays or concerns. Catching potential developmental, behavioral, or social emotional issues early allows for timely intervention when it's most effective. Supports individualized care and learning. Screening results help teachers tailor activities and strategies to each child's strengths and needs. Promotes family engagement. Opens meaningful conversations with families about their child's development and provides them with guidance and resources. Improves child outcomes. Early support can help children reach developmental milestones and be better prepared for school success. Meets licensing, quality, or accreditation requirements. Many state and national systems require documented developmental screening as part of best practice. Strengthens community connections. This facilitates referrals to early intervention, health, and other community services when needed. It equips staff with a structured tool to observe and document development, making it easier to address concerns objectively. Instructions from the developer should be followed to fidelity when administering the tool. Screening tools also identify children whose score indicates a need for a referral for further evaluation by early intervention or professional diagnosticians. When programs conduct developmental and behavioral screens and/or performance-based assessments, there should be a mechanism to share results with families and provide the appropriate referrals for them to follow up on concerns and identify resources to support their children's needs. Programs should establish relationships with agencies and service providers to link families smoothly and efficiently. How many points are possible? This standard is worth up to 4 points. 1 point may be obtained when developmental screening tools are obtained by a program and policy is created related to the implementation of developmental screening. 1 point may be obtained when developmental screenings are conducted at a minimum of 1 time per year for students receiving parental consent, or 2 points may be obtained for developmental screenings performed in accordance with instrument guidelines or at a minimum of 9, 18, and 30 months, as well as 3, 4, and 5 years of age for students receiving parental consent. Additionally, 1 point may be obtained when families receive information related to developmental screenings and, as appropriate, receive referrals for further evaluation. What is the recommended evidence? Examples of evidence can include program policy on conducting developmental screenings, evidence of screenings taking place, which consist of an on-site review of a random sample of 25% of completed developmental screenings for each age group, as well as sample family communication and referral. Depending on how your developmental screenings are done or which screenings you choose, this may include meeting notes from your developmental screening sessions, parental consent forms, flyers announcing developmental screening days, or even a notice on when referrals are made and to whom. Here are some tips. Should you choose to pursue this standard, the developmental screening tool you choose should consider the age ranges you serve. Some developmental screening tools to consider include the Ages and Stages Questionnaire 3, which has screenings for children aged 1 month to 5.5 years old and is completed with parents. The Brigance Early Childhood Screens 3, which has a separate kit for children aged 0 to 35 months and children aged 3 to 5 years old. You may also consider the Easy P tool, which screens children aged 3 to 4.5 years old. Remember that purchasing these kits can be part of what you consider obtaining through your incentive funds. Should you have families who already do developmental screenings with their child's PCP, a note in the file showing the parent refused the service is fine. Part of the standard is that parents provide consent. However, CREASE is only going to count evidence from children's files whose parents consented. What the standard is looking for is whether your program has a system in place to support families in getting children screened. Training in these screens can be found through offerings from Grow-NJ Kids Training Services or your local BOE. When writing your policy for developmental screenings, remember to include who completes the screenings, how often screenings are completed, what happens if a student enrolls midway through the year, how results are shared with families, and how the referral process is completed. Consider what will be put into your staff handbook and what will be included in your parent handbook. How are expectations outlined or explained so that everyone knows what they need to be successful? Now, your QIP. When determining how to tackle the standard, consider assigning one person per age group to oversee the implementation of developmental screening. Start with a manageable screening goal. Then, as you master the process, add on additional age groups or screening cycles. You will want to note who will be trained in this and by when. Who will be in charge of writing the policy and training the staff in this implementation? By when do you believe you can start offering developmental screenings? How frequently do you believe you'll be able to realistically implement developmental screening tools? Perhaps you may start with the goal of doing it one time per year, and once that proves successful, move toward offering it at various developmental stages in accordance with CDC guidelines in subsequent years. Keep in mind that results from these tools may help guide lesson plans for CTL 5. For further guidance on the standard and your specific program's needs, please speak to your technical assistance specialist.